All right, we're back. Today we've got Dan. He's with Physicians Aesthetic Specialist. It's a med spa in Lenexa. So tell us a little bit about your business and how you got started.
So I am a general surgeon by training. I was in practice for 16 years as a highest volume surgeon for a health system in Kansas City. And went through some life changes. I got full custody of my twin daughters when they were 14 years old, which was their choice.
Mm-hmm.
And then shortly thereafter, one of them developed an eating disorder right when the freshman year of high school started.
Mm-hmm.
And so we went to see a therapist who said, if you're her only parent, this is now your only job.
Right.
So that was really the end of my surgical career.
Yeah.
And I took care of her for a whole year, got her through different programs and back in school. And after being away from medicine for that long of a period of time, I realized that I did not want to do it anymore. And I was willing to do anything else with my life. But I did not want to subject myself to that kind of stress. I wanted to be there to take care of my kids through high school. And this just kind of came to me organically. And I decided to get training in Botox and fillers and became a certified medical provider for bioidentical hormone therapy. And it just kind of all started from there. You know, I knew that there is a lot of competition in Kansas City. It's a very super saturated market. So I knew that I needed to do some things to set myself aside. So I kind of identified what I felt was missing. And first of all, access to healthcare is extremely difficult. So try ever getting your doctor on the phone, let alone get a call back from a nurse within a week.
Right.
So I decided to do a concierge style practice. Also, you know, most med spas, they might have an MD as a medical director, or the doctor owns the med spa, but they're not there, or they're still a practicing family practice or gynecologist who comes in and does injections like a half day a week or something. And so I wanted to set myself aside because I want to be a concierge med spa where, as the doctor, I am there full time, and this is my only job. So I've always felt like I want to be the very best at whatever I'm doing when it came to my surgical career. So I felt like there could be no compromise for that in this industry either. So I decided to make myself fully accessible. I had a business phone that went straight to my cell phone, so I could make all the appointments and, you know, text back and forth with patients and just be an accessible physician.
Right.
And first device that I bought was a very specialized type of microneedle device where I could non-surgically do an upper and lower blepharoplasty. And as someone who had undergone plastic surgery to get rid of my eye bags, which are genetic herniated fat pads, you know, where I had to go to sleep under general anesthesia and have incisions all the way across under my eyelids, I thought, oh my God, like there's a device where I could actually do that in the office by just injecting some lidocaine. I felt like those are the types of things that could truly set me aside from everyone else. And, you know, based on that start, what I decided that I wanted to do was, you know, have a wellness side and an aesthetic side. And on the aesthetic side, I wanted to develop a program where essentially I could be a center for face and body sculpting with all the leading edge technology to basically, as a surgeon, wanted to replace the need for surgery.
Right. Yeah.
And so, you know, I accomplished that. I remember going to my first national aesthetics conference for the company that I bought those devices from, called Aesthetic Management Partners, or I refer to them as AMP. And I went and I saw all these national experts on stage, and, you know, not used to going to a medical type conference and feeling so inadequate.
Right.
But I was like, God,
fish out of water.
I don't know shit about shit.
And
I went home like very depressed, and, you know, like I just wanted to just wanted to like turn in my devices and give up, because like I'm seeing all these people who are the very best, but that's not me. And I feel like my approach to things is that I just refuse to not succeed and to not be the very best at something. So, I stuck with it. I got another device. I started to ramp up my social media for exposure. And next thing you know, a year later, that same company, the vice president reached out to me and asked me if I would be on their medical advisory board and if I would be one of those speakers on stage at the national conference.
Very cool.
And so, my career then started heading a whole new direction. And so, now I'm very involved with that company, and I speak on the national stage for them at all their conferences, and I instruct their master classes on facial injections. And so,
very cool.
Come a long way over a few years.
I'd say so, because you started in 2022, right?
Yep.
Awesome. And in the same location?
So at first I started off by renting 2 rooms at a healing arts center.
Oh, okay.
There were chiropractors and massage therapists. But within a year, I built the practice up to where I was renting a 3rd room. Then I had to rent a 4th room, and then I couldn't do it all by myself.
Right.
And that's when, I found the space that we're in at 87 Quivira, and we have got a full staff of 5 people and 4,200 square feet. And that's where we are now.
Yeah. And you got a cool space. I mean, you guys have events down there. I mean, we did just a few weeks ago, we did a workout class right there in your guys' kind of reception or lounge area. So, I mean, you have a cool space that feels accessible, which is cool.
Yeah, I really wanted to design something that was different than other med spas as well. So I don't want it to be like a lobby, small waiting room. And as you know, we call it the living room. So we just want it to feel like a safe space for everyone, that's comfortable, where people can feel like they're a part of our family, because we are a small family unit. And we want everyone to feel like they're welcome to just come in, even if it's just have a cup of coffee so they can talk.
Yeah, love that. So that's a little bit about how you got started, and a little bit about your personal motivation and your passion for aesthetics. Kind of tell me what treatments. It says you offer more than 20 medical and aesthetic treatments for both men and women.
Yeah. So there really is not anything that we can't do. And that's what I really love about it. We've gotten to a point where we don't have to turn away anyone for any problem. So we have devices to truly do a non-surgical facelift. We have a device that not only does it help with body sculpting, like to build muscle and melt fat, but it has a physical therapy setting to where I have taken someone who couldn't even lift their arm without the help of their other arm and was scheduled to have surgery, to after a single treatment where they're able to lift their arm over their head. Or took a 70-year-old who was walker dependent for the past 5 years and put him through 2 weeks of therapy, and he stood up on his own and walked across the room.
So cool.
We have devices to, we can cure urinary leakage for women who, leak when they cough, sneeze, or exercise from having kids. And something that isn't formally public yet, but we will actually be able to treat and potentially cure endometriosis even.
Oh, wow.
So I think that it's really important to be able to offer services that have a balance of, kind of what we call like feeling good on the inside and the outside, right? So you have certain people that come in and they need help feeling better, and they're not interested in their looks whatsoever.
Right.
But, we draw their blood, we get them on our hormone therapy program. It's life-changing. It's life-changing for everyone who does it. And then all of a sudden they're sleeping better. They have more energy. They feel better. They have a better outlook on life. And then they decide, you know what? My face is sagging. They start noticing physical attributes that now that they feel alive, they want them fixed.
Yeah, like the fog is lifted and they say, oh, well, I have this potential to do more.
And then the other way around, where we have people that may come in for an aesthetic treatment to fix something on the outside, And through conversation, or we might even notice in their affect that they're dragging. You start talking to them, and I sleep terribly. Like I have no sex drive, whatever it may be. And then we can talk to them about hormone therapy.
Right.
And so it really can work both ways. It's kind of creating life's balance.
Well, and you guys have, whole body. Anything that's ailing you can address so many different issues in your office, which is cool. You guys kind of look at it as a whole patient, not just one thing or the other, which is cool.
Even something like what I love the most is, in doing surgery, you could save someone's life, and their approach was like, well, yeah, that's what you're supposed to do.
Yeah.
But when people come to our office now, they're looking for you to make their life better. And even something as simple as you take like a college kid who's 21, 22 years old, who has no lips and she's self-conscious about her gummy smile. And within 5 minutes of giving her lip filler, where she can go look in the mirror, like her life has changed.
Right.
Like she might not have hormonal issues yet. She might be happy as can be in, a sorority or whatever. But, just changing that one little thing can change her entire outlook and confidence. And to me, that I have found that to be more rewarding than anything.
Yeah, for sure. I can't imagine the difference that it feels. It's just like we talk about whenever we're lending. There's a reason that people buy a house, and sometimes it's a really fun reason and it's a great reason, and sometimes it's not as fun. And while both feel great at the end because you're getting something accomplished, it's always a little extra special whenever it's a fun reason.
It is. And that brings to mind that I love doing is when someone, man or woman, comes in and they're going through a divorce.
Oh yeah.
And they're ready for change. They're ready to get their self-confidence because they're ready to go back out and meet people, and they want an overhaul.
Yeah.
And I love getting to be a part of that. Or even same thing for a wedding party,
Totally.
Someone's planning out their wedding 9 months from now, it feels very personal and very special when you get to be a part of something like that, when it just has such profound meaning to that person.
Yeah.
And it's always a privilege to get to be a part of that.
For sure. So, you mentioned non-surgical body contouring and facelifts. What are the devices that you are referring to? Tell me a little bit about those.
Yeah. So the body sculpting device, we actually have a couple of them. So we have something called the M-Sculpt Neo. And for any body part that we treat, we do for every 4 sessions, we get a 25% increase in muscle and a 30% decrease in fat.
Oh, wow.
So take the abs, for example. Each 30-minute session with the abs, where you just lay there and we just strap an applicator to your abdomen, every 30-minute session is the equivalent of 20,000 crunches.
Okay, yeah. Very cool.
And it is very cool. And that's also important with our medical weight loss program, because what people don't know is that if I put you on tirzepatide, which is Mounjaro, or Ozempic, right, and someone has rapid weight loss, studies show that 50 to 70% of their weight loss can actually be lean muscle mass.
Right. Yeah.
And, people, they want to lose their fat. They don't want to lose their muscle, but that's also the number one cause for gaining the weight back if you stop the injections, is because if you don't have lean muscle for the insulin storage, then it's going right back into your fat. And so, we use a body scanner to track people's body composition, and we can use the M-Sculpt Neo to build up that muscle through the process, which essentially, one, helps them look better and lose the weight faster, but also it is ensuring long-term success.
Yeah, it's more sustainable that way.
It absolutely is. And then, there's something called the Exion radio frequency ultrasound, which pairs really well with it, because we can take someone right from doing their M-Sculpt treatment into the radio frequency ultrasound, and that burns fat more, and it also tightens the skin. Okay. So, I always say in aesthetics, if you combine the right devices together, 1 + 1 = 5 when it comes to results.
Right.
It's not 1 + 1 = 2.
Uh-huh.
So we can exponentially increase results by combining different modalities.
Yeah, that makes sense.
And it's the same thing for the face. We have something called the M face. The M face is truly a non-surgical facelift, and it addresses all layers from, tightening the skin and getting rid of the fine lines and wrinkles. It can actually, it is a newer non-surgical way of treating under eye bags. It can melt the fat from a double chin. And the analogy that I use with people when it comes to lifting the face is that if you get a brand new hammock, then you lay in it and it's taut and there's no give, but over the course of several years, the weave spreads and the hammock sinks to the ground, and that's what happens to the muscles of the face. So the M face tightens the skin, it restores that hammock to brand new, it melts unnecessary fat, and that's why it's truly a non-surgical facelift. Then we can throw in things like radio frequency microneedling. We have laser resurfacing. So we actually have the most advanced laser resurfacing technology on the market. It's truly the first 4th generation of laser resurfacing. It's called the Nuviderm. Most people, you've had it.
Yep,
you've had it a couple times.
Yeah.
And we were the 3rd clinic in the country to get it.
Oh wow.
So I've actually become one of the leading experts to represent the company that makes the device. So that's part of what I do when I travel to conferences. Is I do demo procedures to help educate other med spa owners that might want the device. I do a lot of post-sales individualized advanced training for med spa owners. So it's something we really enjoy doing, and I think a lot of people know like what Halo and Moxie are. Those are kind of like the common market terms, right? And so basically this laser is an easier procedure for patients to go through with a much shorter downtime, and better results. And that's, what more could you ask for?
I mean, whenever you've done mine, the next day I'm out and about. Not thinking twice about it.
And that's not the case with those other devices.
Is that right?
That's the advantage of having like the latest and greatest best technology on the market. I mean, that's the model by which I'm trying to run the business with. And I mean, I've been thoroughly impressed with that device. Every time you've shown me how it works, and it's incredible. So one more cool one, is the same technology as the M Sculpt. There is a chair called the M Cella. You sit on the chair, and a 30-minute session is the equivalent of 11,200 Kegels. So any woman who leaks, I mean, even a man, like it's typically an older man, but typically women who have had kids, any woman that leaks when they cough, sneeze, or exercise, it is literally gone after the very first session. The chair is also used for it. We can use it to give a butt lift because we can stimulate the butt muscles with it. It increases the intensity of orgasm for both men and women. It can improve erectile dysfunction by 75%. So
very cool.
It's a very useful device.
I'd say. Well, and tell me if I'm wrong, but isn't there, you do something with laser hair restoration?
We do. Yep. So we have a stem cell. It's a stem cell hair restoration program. And it utilizes the laser. So we can use plant-based DNA, essentially. Use the DNA from plants they're called exosomes. And so the plant exosomes are the signal that tells our body to make certain like stem cells and growth factors. So it's the first like very effective, completely non-invasive way of growing your hair back, because all we have to do is ultrasound the stem cell product into the scalp. And then if we add in the laser therapy with the Nuviderm, and those treatments are painless as well, we get really, really good results growing hair that is typically starts to become noticeable after the first month.
And that's quick.
Yeah.
Because I mean, with like a transplant, even it's a year lead time, isn't it? Or something
Absolutely.
like that?
And the whole thing is that, when you have a transplant, it's not doing anything to cure the condition. You're just moving hair from one area to another. But then, theoretically, you should still, after a hair transplant, do the stem cell program.
Okay.
Because otherwise you still have an environment that's not conducive to holding onto your hair.
That makes sense.
Yeah.
I see. Very cool. On top of all of those devices that you have, I mean, you do injectables too. So like fillers and Botox and things like that. Kind of give me a rundown of all the options that you have as far as injectables go.
So one, I like to pride myself in that I think I make the best lips in town.
Yeah.
I do. I love doing lip filler. But we utilize products from multiple companies where to do filler for full face corrections. A lot of people don't know about all the various areas of the face that you can do filler on, like facial. It's all about facial balancing. So oftentimes, like if someone wants their lips to be a little bit bigger, if you put a little filler in the chin to give it projection for balance, that helps a lot too.
Makes sense.
The face needs support, and we lose that support as we get older. Like we lose the deep fat pads in the face, as well as all our bones in our body get smaller, so the cheekbones get smaller. So sometimes adding a little filler on top of the bone restores that support structure that we need, that helps us to look younger again. I think that Instagram and celebrities have given filler a bad name, and I think that that's just from people being overdone.
Yeah.
But what I feel like I'm very good at, and the goal is always that when someone walks out with filler in their face, that no one else is going to know that they had something done. That I would look at you and say, Ryan, you look good. Like you just look more well rested.
Yeah.
Or like, I don't know, like what's changed?
And what are you doing?
Right? Not like, oh my God, did you have filler in your cheeks? Right? So that's the goal. It's all about the natural look. It's not, filler doesn't have to be the Hollywood celebrities gone wrong look.
Right.
All.
Yeah.
And duck lips, which people are always like, don't give me duck lips. Well, duck lips is all about, it's not about the amount of filler, it's about the injection technique,
like the placement and all that.
Yeah. And it's the same with tox. The aesthetics industry is a little bit of a wild west, where so many med spas are just a revolving door of injectors, and the reality is that you only need to have 1 day of training in order to do Botox. So a lot of even like well-known named med spas people know, they need warm bodies because they lose someone. They've got a busy practice, and then you end up with an injector that they got their 1 day of training, and they know that like if you're going to put Botox in someone's forehead, there's 3 injections on your lower row and 2 on the top row, and that's if you want it to turn out like really good and really natural, like even something as simple as tox can go very wrong very quickly and needs to be strategically placed.
Yeah. So. Well, and what product? I know you use more than just Botox. You use different versions of.
Yeah, so there's Botox has just become kind of a generic word because they're all botulinum toxin, but we use our favorite product is called Daxify, because Daxify it kicks in faster and it lasts longer, and it has a peptide that's integrated into it to help it do that, and that peptide gives the skin a nice healthy glow. So it's almost like a skin treatment as well. We use like Dysport and Jeuveau and just about every product out there. And most people they don't insist on a particular product. It's like with filler, we have multiple different types of filler. You've got Juvederm, Restylane, RHA, Versa, and sometimes it's just up to us based on the property of the filler to decide like what's going to be best for this person, based on their age. What do they need done? Do they need more lift? Is their skin weaker? So it's just good for the menu is more for me to use my expertise to decide what product to put in you.
Yeah, great. So you've mentioned to me that you're trying to kind of get the word out about men utilizing your services. I mean, it's something that is less talked about as far as men going into a med spa and getting a treatment done than a woman. So tell me kind of some of your specialized men's treatments, or what you're seeing trend wise from men at like a med spa like yours.
So I think the best way to put it is that, women are begging for help.
Yeah.
And men just want to deny there's a problem.
Yeah.
Right. And so, sometimes their wives have to drag them in.
Uh-huh.
But then on the flip side, there's the fact that like we just need to create awareness and education about what's out there.
Mm-hmm.
And, that like there's a lot of problems that men have that I'll talk about
Mm-hmm.
that it's hard for them to talk about.
Right.
So I'm just going to come out and say it today.
Mm-hmm.
Right. So let's start with hormone therapy.
Mm-hmm. Okay.
So and when I say bioidentical hormones, what that means is plant DNA receptors communicate perfectly with human DNA receptors. So we can use plant-based molecules to recreate the identical hormones that our body makes.
Oh, wow.
In the form of testosterone and estrogen pellets.
Okay.
So the pellets are the pure compressed form of testosterone. And for certain women, estrogen also. And it's a quick 2-minute procedure where I actually implant these pellets in the subcutaneous fat, kind of in the flank or butt area.
Mm-hmm. Yeah.
And they last for 5 months in men.
Oh, wow.
As opposed to when you're doing injections, the injections are synthetic.
Uh-huh.
And also you're getting this just like peak and trough where you inject them, the testosterone level shoots way up, and then it starts coming right back down to where you started. Men feel this like emotional hormonal wave
Right.
through, over the course of a week. It's just not as good.
Like the highest high and the lowest low.
Correct.
Yeah.
And you and I both know that's a toxic relationship,
Right.
Because you cannot have the extreme highs without the extreme lows.
Uh-huh.
And that's not the kind of relationship you want to be in.
Right.
Either.
Right.
I made that mistake more than once. And then you're just chasing the high.
Right.
So let's back it up. So testosterone makes the world go round for men and women alike.
Right.
Okay. And essentially everything that happens to us as we get older that we say, this just sucks because I'm getting older, is actually testosterone deficient.
Uh-huh.
But most people don't know that. And even their primary care doctors don't know that.
Mm-hmm.
Right. And it's just like, these things are happening to you, whether you're 30 or whether you're 50.
Right.
And that you're just like, oh, like this just isn't the way it used to be or whatever. It's all fixable.
Mm-hmm.
Right. So I'm going to tell you what the main symptoms of testosterone deficiency are. And I want you to believe and know that we can actually reverse all this.
Mm-hmm.
Okay. So it starts with loss of sex drive.
Mm-hmm.
Or for men, inability to perform sexually.
Mm-hmm. Yeah.
Difficulty getting an erection or maintaining an erection or the duration of it.
Mm-hmm.
Okay. We also need testosterone to stay asleep at night, but it's also responsible for our deep quality REM sleep.
Okay.
So either people can't stay asleep and they think that it's because they have to pee or that it's their prostate or whatever.
Mm-hmm.
No, it's because, naturally, if you wake up in the middle of the night, you're going to need to go pee. But that testosterone is responsible for keeping us asleep.
Mm-hmm.
Or people sleep through the night for 8 hours and never feel well rested.
Yeah.
Like they only got 3 hours of sleep. It is directly responsible for our energy levels. It's brain fog, focus, concentration, mood stability,
Mm-hmm.
anxiety, even depression.
Mm-hmm.
We need testosterone to lose the visceral abdominal fat, which is the fat that's inside our abdomen. So I have plenty of people that come to me and they say, I've been eating clean and I'm exercising and I've lost weight, but I can't lose my gut. It's because you have to have adequate testosterone to do so.
Right.
It's also why kids in their teens and 20s have a much easier time putting on lean muscle mass in the gym, because I think everyone knows testosterone is needed for muscle.
Right.
But it's not about, this isn't like gym testosterone,
right?
Black market or people shooting themselves up. Like, we need testosterone to function and to survive. And all of these things that we just talked about, they are all reversible. And that's why I would say it is truly life-changing, because we start to lose our testosterone in our early 20s and we lose it at an accelerated rate every year. And the more stress that you have in your life, the higher your cortisol levels, the lower your testosterone is. And women don't even realize that, I think there's a misconception that, testosterone equals men and estrogen equals women.
Right.
But testosterone is 10 times the more predominant sex hormone in a woman over their estrogen.
Oh, wow. Okay.
So it is just as critical to their survival as it is to ours.
I see.
So
Very cool.
We do our own blood draws. It's a comprehensive program, where we do the blood draws, we do the procedures, we have core essential supplements that we guide our patients through, optimize thyroid. This is all about, hormone program. It's all about optimization.
Yeah.
It is not about a normal reference range. So take, for example, your primary care is not likely to ever check your testosterone level. And I just had someone the other day that, I educated them about all this. He's like, well, my doctor said I have chronic fatigue syndrome and that my testosterone was normal because it was 400. Well, all reference ranges is it's the average lab value. So for a person of a certain age, so like if this was a 40-year-old man and his testosterone was 400, all that means is that the average 40-year-old male in the greater Kansas City area has a testosterone of 400. But what if every 40-year-old man is having difficulty with erections, or they can't sleep, they have no energy?
Yeah.
Then that number doesn't mean anything.
Right. Why be average if you don't have to be average?
Correct. So studies show that an optimized testosterone is 1,100 to 1,300, and no one's optimized.
Right.
So I don't need a lab test to know if you're a candidate. It helps guide my dosage.
Right.
If you walk through my door to ask about it, it means you're a candidate.
Yeah.
Because you have something that isn't right about you.
Right. Something's nagging at you.
Yeah.
Yeah.
And we can fix that.
Kind of tell me where most of your clients that come to you for hormone therapy, where do they come from? Like, what's their first trigger?
As far as how do they find out about us?
Yeah. Or like, how does somebody think, oh, I need to talk to Dan about hormone therapy?
I think probably it's largely word of mouth.
Yeah.
Because people just don't know that this exists, period. So
Yeah.
they don't know to look for help in the first place. Right. So, you do get some people who they see it on social media. They come to the website, they see it on the website. Right. But I think that this is an awareness campaign for life.
Yeah.
Right. So it is more about however we've gotten that original population. It's all about people it's like spreading the wealth or spreading the love. Right.
Right.
You got to go see Dr. Dan, I'm doing this pellet therapy and it changed my life. And then because when something is that life-changing to people, then they want to shout it out to the rest of the world.
Right. Yeah.
As opposed to we put someone on weight loss injections and they lose 30 pounds and they just want to tell all their friends, no, I'm just eating right. And I do yoga 6 days a week. Yeah. And it's so am I, but I don't look like that. They still, even though that's the most popular type of drug in the world, people want to deny that.
Yeah.
But you get someone right on their hormones, and not that there should be shame in anything that you come in to do to make yourself better or feel better or look better. There's no shame in it. Right. But people want to share that with everyone they know. So I think that that's probably, the best way. So that's why I'm really happy to talk about this with you today, is because if we can just blast this out there that, hey, you know what, you don't have chronic fatigue, and it's not normal to just because you're 40 and you have a tough job to think that you're getting old, because you don't have to be. This is just a fixable, condition that we all go through.
Yeah. So kind of tell me about as far as a normal week goes, what's your most popular treatment, or what do you do the most of in a week?
I think that's hard to keep track of. Yeah. Because, we have multiple providers in the office doing different procedures. The esthetician might outnumber everybody with the number of stem cell facials that she does. I think every day is a really good, well-rounded mix.
Nice.
Of, we'll do a handful of hormones. We have people that are coming in throughout the day to pick up their weight loss injections that I don't even ever know came through the door. Right. There are regulars. we typically do several laser treatments a day, and then at the same time we'll have someone doing their body sculpting treatments. So
Yeah.
you throw in a few injections. So that's what I like about it. No 2 days are the same. And,
Yeah.
and we have a lot of variety every day.
That's awesome.
Yeah.
So kind of back to the question of men's treatments, what would you say are some of your more popular, outside of hormones, but what are some of your more popular men's treatments that you've been seeing?
So I think that, I've got 2 really exciting programs that I think the first of which is our peptide program.
Mm-hmm.
And peptides have gained a lot of, I would say, exposure lately.
Yeah.
I'd say there's a lot of buzz about them, and it's all over social media. And, I am one of those people that believe that this is the future of medicine.
Mm-hmm.
As long as if the FDA would approve or just get out of the way to let something like this happen, because I am obsessed with learning about peptides, and I've never felt so addicted to knowledge in my life.
Yeah.
But I am, because I have used everything that I talk about, that we do. Like I like to try everything,
right?
So that I can speak to it with authenticity.
Totally.
And I believe that we can live to be 150 with a good quality of life in the future, if peptides are the direction of medicine, right? Because it's current medicine is, and there's nothing wrong with it, but traditional medicine is where someone goes to the doctor because they have an illness, and the doctor writes a prescription for it to treat it, to put a Band-Aid on it. Right? So medicine has kept us alive longer than we did 50 years ago.
Right.
Hormones have improved quality of life. And I believe that peptides are truly the next stage beyond that can repair, rehabilitate, keep us younger. And peptides are chains of amino acids. Some of them naturally occurring, some of them synthetic. Generally very safe. And I have put together different programs where it's a wellness program, right? You're enrolling in our wellness service, and like we use a 3D body scanner to track body composition, and we do blood work. But depending on what does someone want help with, because this is what's amazing, right? If you are into bodybuilding and you're trying to get fit at the gym, right? I can create a program for you that is going to help you build muscle and burn off fat and have more energy, right? We can use peptides that basically improve neurocognitive function, right? So you feel like your memory is not that great, or you've had closed head injury and concussion syndrome. Like there are peptides that are meant to like restore neural connections and improve memory. Sexual dysfunction, there's a lot we can do. So it's pretty much any issue that you want to address, I can customize a plan and make your life better in that category.
So, and would you kind of say then that peptides are proactive, whereas modern medicine now is more reactive?
Yes.
100%. Okay.
100%.
I mean, that's a cool way to look at it too. Like
it's disease prevention.
Right. Yeah. I mean, it is revolutionary if that's the case, right?
If we didn't talk about even the long-term health benefits of hormones, right?
Oh yeah.
So with testosterone therapy, there's some misconceptions, but the reality is that it decreases the risk of breast cancer and prostate cancer. We see a decreased risk of heart disease because it removes coronary plaque and inflammation in the coronary arteries. It improves insulin resistance for diabetics and pre-diabetics. It lowers your cholesterol, triglycerides, and LDL. And there is even a 2 to 3-fold decreased risk of Alzheimer's dementia.
Oh, wow.
So the peptides have very similar benefits.
Yeah.
Right. So this is all like proactive health and improve your quality of life before disease can even come around to ruin it.
Yeah, you're just taking the bull by the horns.
Yeah.
Very cool. So you're saying that that's one of the more popular men's treatments that you see is the peptide thing, peptide treatments, and setting up different plans for these guys. And what else do you offer as far as men's goes. I mean, I know I've done neurotoxins, and I've done that laser treatment and facials and things like that. But what else?
So what I am really excited about, and the next thing that like I really want to be known for is sexual wellness. But you know, like the girls in the office, like they can address the female sexual wellness, but I want to address male sexual wellness. And these are things that are they're difficult issues for people to want to talk about, right?
Yeah.
So, you know, we have technology to treat erectile dysfunction. Getting someone's testosterone optimized helps with erectile dysfunction,
right? And
then now we have peptide injections that can also help. So I really don't believe that it should be like choose this or choose that. You know, I've developed really well thought out programs, and so probably the one thing that either people truly don't know about, but they thought about since they were a kid, is, man, I wish my penis was larger. Right. And the fact is that, like, no matter how big or small a guy's size is, like if you sat around a bar enough or with your friends, and you know, like most guys, they want to be bigger no matter what. You know, it's whether it's an ego thing or it's a lack of self-confidence thing. Because I do think that, you know, as sadly as it is, that almost like the more in shape that someone gets, then they do develop body dysmorphia, right? So it's I've even been guilty of that, right? Like I'm in the best shape of my life right now at 51. And sometimes I'm looking at other people in the gym and I'm like, God, I wish I looked like that. And it's almost like I'm not seeing myself for who I really am in the mirror until someone else is like, man, you're really cut. You know? And like, you need to hear that, right? So when it comes to, you know, enlarging the penis, I mean, this is something that, like, one, why does it need to be any different than a woman getting a boob job?
Right. Yeah.
Right. But the only way for that to happen is they've got to undergo surgery, and they're proud of it. A woman gets a boob job. Most of them, they've got them hanging out. They're wearing low cut stuff. They've gone and bought all new clothes that are, you know, 2 sizes smaller for their boobs that are 2 sizes bigger. And you know what? That's society. Like, there's nothing wrong with it. I love boobs. That's great. Right. So why does there need to be any shame in a man doing the same thing? But what's really cool is that, you know, because I love science and, you know, I love being on the leading edge I love being an innovator,
right?
And doing things as naturally as possible. So, you know, I think most people know that, like, about filler in the penis, but you know, that's hyaluronic acid based filler. It's synthetic, but we actually use a filler in the office called Derma PRP that is a biologic filler. So it's all natural. So what I do is draw your blood, spin it down, and take the plasma, and a lot of people have heard of PRP. That stands for platelet-rich plasma. Yeah. The platelets have the growth factors in them, right? So they all sit at the bottom of the plasma sample. So then we take the platelet-poor plasma part, and I put it through a special heating and cooling process and turn it into a filler that's made from your own blood. Oh, wow. Then I mix the filler with the platelet-rich plasma. So now I have a really great filler that has growth factors in it that all comes from you. Oh, wow. Right? And so I use that to inject and enlarge the penis, and it's all natural. And the great thing about it is that it's done with a nerve block, and there is no pain. There's no pain afterwards. You know, the swelling is, you know, because I use peptides. So like I'll use a couple of peptides like BPC 157 and TB 500 and inject, you know, before the procedure and after, and it reduces the inflammation so much. And in combination with putting like some plant-based stem cells topically on, swelling is down like 100% by the next morning. So it's virtually the only thing anyone feels is the initial injection of lidocaine into the skin. Yeah. And then essentially there's no recovery. And, you know, we can tailor it to whatever, you know, size someone wants, but it always looks natural. And the nice thing is that any filler dissolves over time. But the idea behind a biologic filler with growth factors is that as the filler starts to dissolve or dissipate, the body is actually building collagen behind it. So you're actually getting natural growth to replace that. So it's pretty easy to like naturally gain a couple of inches of girth, right away. And that's after the swelling's gone down, after completely gone after a week.
Right. And then, so for that PRP, do you use that for other types of fillers as well?
Yeah. So we actually, it's a really good filler to use in the face.
Is it? Okay.
Yeah. Especially when someone gets older, where, it's not just about like, oh, I want my cheeks to be a little bit bigger, but it's about like, we need to rejuvenate the skin along with giving them that volume and really replace their collagen. Real commonplace is it's the only type of filler I will use for under the eyes. Is that natural derma PRP filler. Okay. And it's really good as we get older. Volume loss definitely happens in the temple region for people that are skinny. And so filling that up in a natural way builds collagen that helps lift the entire face.
Yeah, that makes sense. Well, yeah, because you said, if it's got a more lasting effect, that's even just your body's reaction to it, that's hugely beneficial, right? Yeah. That's cool. I
want to go back to the topic of the male enhancement.
Oh yeah, yeah.
So, we can tackle a couple of issues at the same time when it comes to male enhancement and sexual wellness. So maybe someone wants more size, more girth, more length, but they also have some issues with their erection. So at the same time as doing, the injections for enlargement, we can do something. Well, the word P-shot, that's a trademarked name, right? So whatever. But really, what it is injecting PRP into the muscle of the penis itself, and that stimulates new blood vessel development, growth factors, things that will help to cure erectile dysfunction.
Okay.
So, I kind of came up with this comprehensive program. I mean, sure, you can go to a lot of hacks out there that would gladly just try to put some filler into your penis to make it bigger.
Yeah.
But, I'm doing this from a comprehensive medical standpoint. So it's like, if I'm going to enlarge, then why would we not also have a sample of PRP that we are going to inject in that P-shot intended fashion, using my own technique, not that trademark technique, but the same idea, right? Let's improve the function and let's improve the size.
Yeah.
And then let's use peptides to reduce inflammation and actually improve the longevity by helping to grow blood vessels, which will deliver the nutrients to make this whole situation healthier long term. And then we can add in something like the Emcella and have them sit on the Emcella chair and, even further improve their erectile dysfunction. So and make sure that their testosterone is optimized. So with anything I would do, I want to take a comprehensive medical approach so that I can give you the best chance of having the best outcome with whatever we're doing.
Right. Yeah. I mean, a holistic approach.
Yeah, absolutely.
Very cool. So tell me a little bit about, you guys do a ton of work on your social media, and you're always doing stuff. You're always doing events. There's always something going on. So kind of tell me about your guys' events and your specials and all of that piece of the puzzle there.
Yeah. So really part of designing the space was we wanted to be able to host different events. As you mentioned earlier, we did a Saturday morning Pilates session, which once the summer crazy months are over, we're going to get that regularly scheduled so that hopefully we're going to do, an open house Pilates event with a personal trainer once a month. We try to host events once every 6 weeks or so. Nice. And so we have an event that's coming up, which is just a women's only event. And, and then as a follow-up to this, I want to host a male only men's night event. Like, would you help me with that?
Absolutely.
So let's have we can call it a Scotch and cigar night or whatever we
Yeah.
want. But let's have just an open men's forum.
Yeah.
There's no women there to judge, and I can educate, and people can openly ask questions about anything they otherwise didn't know to talk about or have been too shy to talk about.
Right.
Let's have that safe night where guys can sip scotch or bourbon, and let's just like talk about how to, like, you know,
Help feel better, look better,
make ourselves better as men.
Love it. I love it.
As men.
Yeah, I'm on board. Let's do it. But
we do other events that we typically do, like we do a Galentine's event, so we always have something on Valentine's Day, and which is not women's only. We have a lot of women. They bring their male friends or husbands or boyfriends or whatever, and that's great. We always do a Mother's Day event and a holiday event that we try to do a few weeks before Christmas. So just like to make them like social fun and good food, drinks, and throw some good deals in there.
Yeah, of course. So tell me about your guys' mission statement at Physicians Aesthetic Specialists.
So I put a lot of thought into this, right? You have to come up with your mission, vision, and values, and then there has to be a why behind it, right? Because if we're gonna work as a family and be a family, it's important that everybody buys into the reason why we're all doing this,
right?
And then if everyone truly believes in this, the same purpose of what we're doing, then that translates into good patient care, and they're going to pick up on it, and everyone's happier, right? So, here it is. This is my whole why behind doing all of this. So, it's empowering your life with confidence and self-love through meaningful connection with honest expert care, innovative treatments, and the fusion of science and passion.
Love it.
And I think that says it all.
Yeah, and I mean, you guys really do embody that every day with each treatment that you do, and then just like we talked about earlier, as a holistic approach, you're treating each individual person as a whole person, and you're looking at how can I make them feel and look and be the best version of themselves as they can be.
Yeah,
which is great. Very cool.
That's what I love to wake up and do every day.
Love it. Love it. Well, thanks again, and I think we should do this again.
Absolutely. Anytime.
We'll do it again soon. Okay. Thanks, guys.
So with fall coming, we absolutely have really good deals on laser resurfacing.
Right on.
For sure.
Very
because if you're thinking about planning for the holidays, right? And a lot of people that they've waited to do their laser treatments because they know they're out in the sun all summer.
Totally.
And so when it's the end of pool season, right, then people are ready to do stuff again, and the kids are back in school or whatever. But what people really don't think about is, like, now is the time when you should be planning for
Christmas and New
Year's,
Yeah.
right? So, like, if you want your face and your skin to look its best for New Year's Eve, like, it is literally time to come in and have your first fall laser treatment right now.
Yeah.
Because, it's a package of 3. And you've seen the results. You know what it does for your skin, right?
Yeah.
You don't want to wait until 2 weeks before the holidays. Like, a lot of women, like, they've already got, like, their nail and hair appointments scheduled out through the end of the year that are timed correctly, right?
Yeah.
So there's no, you got to do the same thing. You need to do the same thing with your face too,
right?
So take the lead from the women that know,
right? Well, and yeah, like you said, you plan. What is that? 5 months from now? That's you still. I noticed that I still saw improvement in my skin 4, 5, 6 months after.
And generally, anything that we do to build collagen is going to continue to build collagen for 90 days.
Wow, very cool.
Yeah. So it's great that you saw it even longer, but we typically, even if someone comes in after laser treatment for their pictures after 2 weeks and they look great, it's like, well, give it another 3 months from now when you're really going to look great. So that's why you want to look the best for the holidays. It's time to come in and find one of our specials on lasers right now.
Love it. Love it. Love it. So what advice do you have for men that are considering aesthetic procedures for the first time?
My advice is to not be afraid to just come in and talk to me. I do free consultations, and we can sit down for an hour or however long it takes.
Mm-hmm.
And what we pride ourselves on is knowing that people just want to be heard,
Mm-hmm.
right? They want to be heard. We are all about, like, I want to know what brought you in, like, what is it that really bothers you,
Mm-hmm.
and let me educate you, not sell you.
Yeah.
I want to educate you and come up with a well thought out treatment plan to help you accomplish your goals. And that is a safe space that's private and protected
Mm-hmm.
for you and me to have our own private conversation and help make a plan for you to feel better about you.
Yeah. You can sit down, kind of get some goals, and
you got nothing to lose. You got nothing to lose by just coming in for a conversation.
And what's the easiest way for them to do so? Do they call you? Do they stop by? What's the easiest?
Well, the easiest way is you can call the office, which is 913-706-0088.
Uh-huh.
We also have on our website, which you can get through to, it's either paslenexa.com or the longer way is physicianaestheticspecialist.com. And we have contact forms, right? You can even do a virtual consultation, where it's our treatment builder that helps to educate you about treatments based on various problem boxes that you check.
Mm-hmm.
And then that's one way that then we have your information to reach out to you. So we make it very easy.
Yeah. Well, and
you can even book your own appointment online off the website.
Oh, that's incredible. Yeah, because I know that's a barrier for especially younger people. Sometimes they don't want to talk on the phone. They just want to go online.
and generally, if someone fills out, it's funny that you say that, because if someone fills out a form on our website with their contact information, our first approach to contacting them is by text.
Yeah. I'm sure that
because no one wants to talk on the phone.
Right. I'm sure you get a better response out of a text than a call.
Absolutely.
Anyway. Very cool. Well, I mean, it sounds like you've got a great thing going. I mean, and I'm speaking from experience, you do. I've been down for events. I've had treatments. I'm excited about all of the info that you have to share, and I'm excited about this men's event that you have planned coming up too. Once we get details, I'm excited to share it. But those are all the questions I had today. Anything else you wanted to share?
No, I appreciate you having me on.
Yeah.
I just want to be able to let people know what's out there, and that I'm an ally. I'm here to help. My goal is to just help make people's lives better.
Yeah.
By whatever that looks like for them.
Yeah, an individualized approach. I like that idea.